Okay. Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type that in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you, Rachel. Good morning, everybody. Glad you could join us on this Monday morning. I hope everybody can see my screen. I think I'm already sharing. And so we're going to go ahead and get started because we do have an awful lot to cover this morning. Before we get started, I do want to remind everybody that the Medicare Assistance Program is a grant-funded program. We have grants through the Administration for Community Living that give us funds to go out and educate people about Medicare and all things related to Medicare, including Medicare fraud. So we have our SHIP grant, our SMP grant, and our MIPA grant, and we partner with multiple agencies around the state to help bring this education to Oklahomans. Now, before we get started on our main topic today, which is Medicare Supplement Insurance, I want to remind everybody that Medicare open enrollment period starts next week. That's October 15th through December 7th. We want you to be reviewing your healthcare coverage as well as your drug coverage. Make sure that it's covering all of your needs and that all your drugs are going to be covered and that your health insurance is giving you the coverage that you want. Make sure that you are reviewing your annual notice of change. That's the document that you should be receiving from your health insurance that lets you know what's changing about your current coverage in case there's anything that you want to change about it. Same thing for your drug coverage. If anything's changing, if they've added any new medications, taken any drugs off, if they're altering their co-payments, et cetera, et cetera. Also, want to make sure that has anything changed about you? What's happening in your life? Like, have any of your medications changed? Have you moved? Are you living somewhere different? Are you using a different pharmacy? Any of those things can make an impact on your current coverage. So we want to make sure that you are paying attention to that. Also, anything changed about your physicians? Are you seeing a new doctor? Are you needing to see a different doctor or anything like that? Because that also might have an impact on your health insurance. So where do you go if you've got questions about your coverage? If you want to ask somebody questions about what plans are available or what plans have the benefits that you want or what plans have the medications that you need, et cetera. Of course, you can call our program, the Medicare Assistance Program. There's our phone numbers and our website. You can always call Medicare directly, 1-800-MEDICARE, and there's their phone number as well. I put that E on there. It's kind of funny. If you actually were to call 1-800-MEDICARE, the E just kind of hangs out there. There's not really a number for it. There's the number itself, but if you do actually press the E, it's okay. It's not going to make the phone number do anything weird. Also, their website, Medicare.gov, is a great website. It's got lots of really good information as well. The Medicare and You handbook, everybody who is on Medicare should have received their Medicare and You handbook in the mail already. It's also available electronically. So I would encourage you, if you haven't taken a look at that Medicare and You handbook yet, look at it. A lot of the information that you might have questions about can be answered right there from that book. And then, as always, take advantage of local insurance agents. They're a really good resource about what's available in your market, where you live and stuff. So please, take advantage of that. Talk to your local insurance agents and see what's new. So today's topic is Medicare supplement insurance. Medicare supplement policies have actually been around for a long time, but there are some new things about them that you might want to be aware of. Now, we're going to cover this pretty thoroughly in the 30 minutes that we've got, just for those people who may be new to Medicare supplement policies. So first, we got to kind of start out with the basics of Medicare, so you know what we're talking about when we get to Medicare supplements. I'm going to share with you some information about Medicare costs, and this is based on an estimate. They haven't really announced what the costs are going to be yet for 2026. We were hoping we might hear something, but that was kind of a pipe dream. We really don't usually hear that information by now. But for 2026, according to what the Medicare trustee report says, these are the numbers that we're hearing. So the Part A premium, most people get their Part A premium free because they've been working for 10 years paying FICA taxes. Some people, however, don't get their Part A premium free. They haven't been working long enough. And so for those people who work between 30 and 39 quarters, they might get their Part A for $285 a month. That's according to the estimate based on the Medicare Medicare trustee report. If they've worked less than 30 quarters, though, they're estimating that the Part A monthly premium would be $518 a month. So as you can imagine, that's pretty pricey. Now, the Part A deductible, which everybody would pay, is going to go up to $1,716, according to that trustee report. And that's going to cover the first 60 days of any inpatient hospital stay per benefit period. Then starting day 61, the beneficiary would pay 400, and starting day 61 through 90, that would be $429 a day. And then starting day 91 in that benefit period, that would go up to $858 a day. And that's per benefit period. Now, Part A, besides covering inpatient hospitalization, it also covers skilled nursing facilities, hospice care, and home health care. Those are the things that are going to be covered by Part A. Part B costs, and again, we're talking in estimates here because we haven't had an official public announcement yet. It appears that the Part B monthly premium is going to go up to $206 a month. It could be slightly more than that for people who are in a higher income tax bracket. If you're in a much higher tax bracket, it could be quite a bit more than that. The Part B deductible is also going to go up. It's estimated it's going to go up to $288 a year. So that's what you would pay at the beginning of the year before your Part B benefits would kick in. And then after that, you would pay approximately 20% of your costs, depending on what benefit we're talking about. So what exactly is it that Part B covers? Part B covers your outpatient services, things like emergency room care or observation days in the hospital. It also covers doctor's visits, whether we're talking about a primary care doctor or a specialist, laboratory services, x-rays, medical equipment, things like wheelchairs, CPAP machines, and things of that nature. It also covers preventive services, things like mammograms and colonoscopies and things of that nature. Those are the items that are going to be covered by your Medicare Part B. So again, as I said, your Part A benefits and your Part B benefits, Medicare Part A and B are going to cover approximately 80% of those costs, leaving you with about 20%, which can still be pretty sizable when you think in terms of what healthcare costs are in today's market. So that's one of the reasons why we have Medicare supplement insurance. It's also called Medigap insurance because, as the name implies, it covers the gaps that are left over after Medicare is paid. First, Medicare is going to pay, and then your Medigap policy pays after that. In a typical situation, what happens is after you've received services from a provider, the provider sends the claim to Medicare for Medicare to pay the part of it that they're going to pay. After Medicare pays, they then forward that claim onto your Medigap policy for the Medigap policy to pay what they're going to pay on that claim. If there's any balance left after that, then that would be yours to pay. If you've got a Medicare supplement policy that perhaps doesn't pay everything that was left on that particular claim. There are 10 standardized policies that are available out there. Most of us nowadays only have 8 of those policies available to us because we didn't become eligible for Medicare until a later date. There's a few people that became eligible several years ago that might still have the ability to get a Plan C or a Plan F, but most of us only have 8 of those plans still available. Each of these plans provides different benefits, and there's a list that's available that we'll see here in a minute that shows us what those benefits are. Now, the benefits on each of these standardized plans are the same. What's available to you on a Plan A or a Plan C or a Plan G or a Plan K are all going to be the same. What's going to be different about those is the price that you pay. So it's very important that when you're shopping around, you're not necessarily focusing on the wrong items. And we're going to talk a little bit later about some of the things that are really important to look at and some of the things you really don't need to pay attention to. Now, Medigap plans can be used anywhere that Medicare is accepted. When people are trying to decide how they want to get their coverage, and their options are they can just keep their original Medicare, which covers, as we said, approximately 80%. They don't have to get a Medicare supplement policy. They don't have to get a Medicare Advantage plan. They could just keep their traditional Medicare if they feel like they can foot the bill for that 20%. But a lot of times people would like to have that Medicare supplement policy to cover the remaining amount that's left over, or they might want to get a Medicare Advantage plan because they're used to using a managed care product. Maybe they had one when they were employed while they were working and stuff, and they're familiar with how those work. It's kind of what you're used to and what you're comfortable with working with. So one of the things that people sometimes are considering whenever they're trying to decide, well, do I want to get a Medicare supplement policy or do I want a Medicare Advantage plan? One of the things that they think about is, do I travel very much? Am I going to be going a lot of places and stuff? Something to consider is with a Medicare supplement plan is they're good anywhere in the country that Medicare is accepted. So if you are somebody that plans on doing a lot of traveling and you're going to be all over the country possibly, you wouldn't have to worry about if you're in a service area for a particular Medicare Advantage plan. If you're somewhere where they accept Medicare, they are going to accept your Medicare supplement insurance. Now, they don't cover prescription medications. So that would mean that if you go the route of getting a Medicare supplement plan, you would need a separate prescription drug plan. So whereas with a Medicare Advantage plan, most of the time they do cover the prescription drugs, with the Medicare supplement policy, you would need to get a standalone prescription drug plan. Now, when's the best time to purchase a Medicare supplement policy? For one thing, it's important to note that you do have to have Part A and Part B. So you would have to have Part A and you'll have to have Part B, for which you would have to pay that monthly premium, which we said is $206.50, we think, for next year. The first opportunity that a person has to purchase a Medicare supplement policy is the 6-month period that immediately follows when they enroll in their Part B. And during that 6-month period, they can purchase any of the Medicare supplement policies that are available in the state of Oklahoma, and they don't have to worry about any underwriting or pre-existing condition clauses. They can get that policy, all right, because they can't be denied because of any current or pre-existing conditions. Outside of that 6-month period, though, they might have to be concerned about that. So if someone has a heart condition or diabetes or something like that, it's really a good idea to seriously consider, if they think they want a Medicare supplement policy, getting one during that 6-month period right after they start their Part B. Now, there are some other opportunities that exist for someone to get a Medicare supplement policy and have what they call guarantee issue rights. That means that that's another time period during which they can't be denied a policy. This would be things such as maybe they were working past the age of 65 and they've retired. They would have 63 days during which they could purchase a Medicare supplement policy. Not every one of them, but most of them during that 63 days, and they wouldn't have to worry about any pre-existing conditions. Also, maybe if somebody was on, let's say, a Medicare Advantage plan, and that Medicare Advantage plan pulls out of their market, it's no longer available in their area. That's another condition that creates these guarantee issue rights. So there's several of those situations that exist, and you can find the information about those guarantee issue rights in this little booklet, the Medicare Supplement Insurance Buying Guide, that's available through the Oklahoma Insurance Department. You can go to our website, and I've got the information about where that's located at the end of this presentation. We would be happy to send you one of these, or you can actually look at it right there online on our website at map.oid.ok.gov, and it'll give you that information. Now, here's the chart I was talking about that tells you about each of the plans that are available. And as you can see, they are designated by letters. There's a plan A, a plan B, a plan C, D, F, G, etc. And the check marks underneath each one of those letters establishes what are the benefits that are available for each one of those plans. And the benefits are listed there in that left-hand column. So someone who is shopping and interested in purchasing one of these policies can look down through there and identify which of these policies or these plans is the one that they're most interested in. A lot of times when we're talking to people, they tend to be very interested in the Plan G. Plan G is the one that for most people who are just now becoming eligible for Medicare, they tend to be the most interested in because it covers the majority of the benefits that are still left over after Medicare has paid their portion of the claim. The only thing that Plan G does not pay for is the Part B deductible. That Part B deductible, was it $288? I think it is what's going. Yeah, it's going up to $288. So that means that a person who has Medicare Part A and B and has a Plan G would pay their Part B, their Part B monthly premium. They would also have to pay their Part B deductible, but outside of that, all their costs would be paid for by their Plan G. They would also, of course, have their Part D, as in drug, monthly premium to cover their drugs. This chart is also available in that information that I was sharing with you in that buying guide. Now, for people who are on disability, that information is going to be a little bit different. If you're on disability, that means that you are under the age of 65, but you're on Medicare because you're on disability and you've been on disability for at least 24 months. Now, the laws regarding people on Medicare and disability as it pertains to Medicare supplement policies varies from state to state. The law in Oklahoma says that any carrier that offers Medicare supplements in the state of Oklahoma must offer at least one of the 10 standardized plans to people who are on Medicare due to disability during that time period, during their open enrollment period. Most of the time here in Oklahoma, that is Plan A that they offer. They cannot charge that individual more than the lowest aged rate. That means they can't have a higher price for people who are under the age of 65. It has to be the same price that they charge somebody that's over 65. Now, the next thing that I wanted to share with you is about the birthday rule. Now, this is fairly new. This started in 2023, toward the end of 2023. This is for people who currently have a Medicare supplement policy. This isn't for people who are, say, on a Medigap, a Medicare Advantage plan or that don't have a Medicare supplement policy. This is for people who are currently enrolled in a Medicare supplement policy. It allows those people to purchase a different Medigap policy of equal or lesser benefits during a 60-day period that starts on their birthday each year. This happened because we had a large number of seniors who were trapped more or less in very high priced Medicare supplement policies. We talked a little bit earlier about how individuals could purchase a Medicare supplement policy during that 6 month period when they first started their Part B, and they couldn't be denied because of any current or pre-existing health conditions. However, once a person had purchased their Medicare supplement policy, oftentimes they would get sick and they would have health conditions that would keep them from being able to purchase a different policy. And so they were stuck there. They had to continue paying increasing premiums for those same policies, and they had nowhere to go. The birthday roll allows those people the opportunity to shop for and purchase a lower priced Medicare supplement policy of equal or lesser benefits and gets them out of that trap. So this has been a real lifesaver for a lot of our seniors. During this time period, during that 60-day period, there's no medical underwriting, there's no pre-existing exclusions or anything like that. It gives them a great opportunity to possibly save a lot of money. There's individuals that we've helped who were paying between $400 and $600 a month for a Medicare supplement policy that have now been able to greatly reduce those premiums and have saved themselves hundreds of dollars a month. So this has been great. The other half of that rule change that took place at the same time was we talked earlier about the people who were on Medicare due to disability and how those individuals had the ability to purchase one of those standardized plans while they were on Medicare due to disability. Well, those same individuals, when they turn 65, they get a whole new open enrollment period during which they can purchase any of the standardized plans that are available in the state. This new rule also requires their current carrier to send them a letter reminding them that they have this new open enrollment period during which they can purchase any of the standardized plans that are available during that open enrollment period. Now, for any additional information you might want to learn about these birthday rule, you can go to our FAQs that are on our website. There's the link right there, and you can learn all sorts of stuff. There's some good information there about these FAQs that we've, as people have been asking us questions and pointing out things about the rule, we've tried to capture that information and collect it on this website so that other people who might have additional questions can go right there and learn as much as they might want about the birthday rule. So when you're shopping for a Medicare supplement policy, we want you to review that chart that we showed you, look at those covered benefits, decide what are the things that are important to you. Give us a call. We can actually run a quote. We've got a tool that's available to us, and you tell us which of those plans, A, B, G, K, whatever you're interested in. We'll ask for a few details from you to run that quote. We can send you that information electronically, or we can print it out and send it to the mail if we need to. And then once you decide, what you're interested in, you can contact the company. We can't sell you a policy. You have to go through a licensed insurance agent to actually purchase a policy. But you can contact the company, identify who a local agent is, and then contact that agent to actually purchase your policy. Now, when you are comparing these insurance carriers, we've talked about how you compare the policies. What are the benefits that are important to you? And as we said before, the plan A's are all going to be the same. The plan G's are all going to be the same. The benefits are set by law. But there are some things that you want to consider when you're looking at the different carriers, because not all carriers are exactly the same in the same market, okay? When we send you that comparison, there's going to be some details on there about each one of the carriers that are things that you should consider. Now, they're not hard set in stone, okay? But there are things as a consumer that are things that you want to consider. Some of the things that we like for people to kind of, notice are how many years have they been in the market? It'll tell you how many years that particular carrier has been in the market. So probably more years in the market is better than fewer years. If they've only been in the market 1 year, probably don't have as much experience. What's their rate increase history? Do you see a history of a lot of erratic rate increases, or are they pretty steady? Medical loss ratio. A medical loss ratio is basically telling you how much of the money that that company collects is actually going toward paying medical claims. 65% is the minimum medical loss ratio. 80 to 85% is a lot we see that a lot, okay? If you see a medical loss ratio that's over 100%, that's definitely not a company that you should be writing with, because that means that they're spending more on medical claims than what they're taking in, and I don't see how that could be sustained. Also, you want to look at the number of lives that that company has. Uh, a company, actually, with any of you that are any good at math, and trust me, I'm not good at math, but if you're doing any kind of statistical work or anything like that, you need a certain minimum number of subjects for those numbers to be statistically sound. And when you're looking at an insurance environment, the experts will tell us that anything less than 500 lives in a state means that the data is really not actuarially sound. The same on the national level. If it's less than 5,000 lives nationally, that the data is not necessarily actuarially sound either. So the more lives there are, the more you can trust that their data is going to be more concrete. Well, also, when was the date of their last rate increase? If their last rate increase was very recent, then that means it's probably going to be a while before they have another rate increase. If it's been a long time since they've had a rate increase, then you might be aware that maybe they're going to have another rate increase relatively soon. Wanted to point out again, our Medicare Supplement Buying Guide, along with the addendum. There's an addendum that we include with that that's got any recent new information, is available on our website. Now, this is our resources. That's how to get in touch with us. Again, I want to stress with you, talk to a local licensed agent. And by local, I don't necessarily mean they have to be across the street or even in your town. I know a lot of our small towns may not have agents that sell every single company that's out there. But if you have to talk to someone in the next town or something like that, I still consider that to be local. What's nice is that you're able to get in touch with that agent again. Oftentimes, whenever you're calling the company or you're calling an 800 number, you don't know who you're going to talk to the next time you get in touch with them. So I just feel like there's a lot of value to being able to speak to someone, just as with same as when you're having trouble with your homeowner's insurance or your car insurance. So just be aware of that. These are the agencies that we work with around the state who have trained counselors that can assist you in your local area. So don't hesitate to reach out to them if you'd like to make an appointment to talk to somebody. These people, as I said, they've gone through the same training that we go through. If you've got a question that they can't answer, they know how to get in touch with us, and we can help them out as well. So feel free to reach out to them. And now we can answer any questions that anybody's got.
Yeah, so it does look like we have one question, and this might be one that might need an email follow-up because it's a little bit more tailored to this individual. But the question is, I don't understand why I'm having to pay for visits that used to be free. I'm told something about having to do with the clinics being tied to a hospital. But it looks like maybe Ray, we would need some more specific information on that.
Yeah, they would have to call because that's getting into specifics that we really, with HIPAA and everything, they can call the 800 number. And let me see, is that on?
And
Well,
Ray, could they also send an email with that question?
they could, but again, the with the phone number, we can ask questions back easier.
Perfect.
You know what I'm saying?
Mhm.
Um,
Yeah, so if you want to call MAP for the person who asked that question, then they will be able to better assist you with getting a good answer.
yeah, and I would also recommend possibly calling that doctor's office too and getting more information as to why they're claiming that the fact that they're tied to a hospital is creating some reason why they're claiming that that's costing money, because that information would be important uh, if a counselor is going to research why that's costing money now.
Perfect. Okay, so we've got another question. How do I get the data to compare the companies?
It's on the comparison. If somebody is interested, all you have to do is figure out if you want a comparison on a plan A or a plan G or whatever. Send us an email and say, I would like a comparison for a plan G for a male or female, your age, your zip code, and whether or not you use tobacco products. And we can send that to you, and it will have that information right there uh, on the comparison.
And then we've also got a question, exactly where on the website is the request for the booklet? Not sure what they mean by the booklet.
You can actually go to map.oid.ok.gov, and in the left-hand column, there is a whatever you call those things, table of contents, whatever. Rachel can help you with the technical terms. But at the very bottom, there's one that talks about Medicare supplement insurance. And if you click on that, it'll take you to that booklet.
What I'm going to do, everybody, is I've got the link for that. I'm putting it in the chat right now. And so if anyone would like to just be able to click on the link, you can go in the chat right now in our meeting, and that link is available that goes directly to the Medicare supplement insurance information for everybody to see.
Thank you.
Absolutely. Okay. And then we've got two more questions. We'll go real quick. And then if there's any other questions, go ahead and email us because we're running short on time. But we do have a question. If you have an Advantage plan, are those companies rated as to who is best?
Okay, with the Medicare Advantage plans, there is a 5-star rating system. Now, as far as where that information is located, it's going to be either in the Medicare buyer's guide. It's probably going to be also in Plan Finder, and that information should be there by now. It's on Medicare.gov. If you go to that website and click on Find Health and Drug Plans, you should be able to see their star rating next to their names whenever you do a plan comparison.
Okay. And then someone else said, I have a plan now, so can I only change companies under the birthday rule or during open enrollment?
Okay, if you have a Medicare supplement plan, the current open enrollment that we're talking about that's from October 15th through December 7th has nothing to do with you except for your drug plan. Okay, Medicare supplement insurance operates away from the October 15th through December 7th timeframe. If you've got a Medicare supplement plan, you can make changes to that using the birthday rule from the time, from your birth date for 60 days. Your drug plan, though, you can change during this open enrollment period. I hope that answers the question.
Perfect. And then we did have someone ask us to get the email address in the chat. I just put the email address in the chat. I'm also going to put the phone number in the chat for everybody. And then one last question. Are you going to talk about Advantage plans in the future? And Ray, we usually
Yes,
do this every year.
yes, we definitely will.
Perfect. Well, that is all of the questions that we have. And like I said, if you guys click on that chat, I believe it's sort of in the middle of the bar at the top of your screen. It says chat. There's the link for the Medicare supplement guide. There is the email address, which once again is map@oid.ok.gov. And I've also put in the phone number. We've got 405-521-6628. We also have the 800 number, which is 800-763-2828. So that's both of those are going to get you directly to MAP. And then Ray, any other information you want to provide?
No, I did want to point out, and I'm glad you said that about the phone numbers. The reason why we have the two phone numbers, folks, if your phone number has an area code that's from outside Oklahoma, don't use the 800 number because for some reason it won't work correctly. Use the 405 number if your area code is from outside Oklahoma.
Perfect. And just a friendly reminder for everyone, because this is great information for you all to have. At any time, all of our Medicare Monday webinars are recorded and available to watch. When you go to the website, which is map.oid.ok.gov, you can click on the Educational Videos tab, which is on that left-hand menu, and we're going to have all of the recordings from all of our past webinars available for you to access there.
Okay. All right. Thanks, folks. I appreciate it. And we will talk to you next month.
Thanks, everyone. Bye-bye.